Hello, my dear students. This is your Dr. Janadul Amin. Today, we are going to talk about a topic which is very important in medical field, that is anaphylactic shock. I have made it very simple for you guys so that you can memorize it very easily. So let's start. What is an anaphylactic shock? Anaphylactic shock is an acute systemic IgE mediated type 1 hypersensitivity reaction. You have to remember this, it is IgE mediated type 1 hypersensitivity reaction occurring within minutes to seconds after exposure to a foreign substance. You all know that when there is an exposure to a foreign substance, there is release of histamine in the body. That is the actual definition of anaphylactic shock. Now if we are gonna say that अगर किसी पेशेंट को एनाफाइलेक्टिक शॉक हो रहा है, what is gonna be the presentation of the patient? What is gonna be the clinical features of the patient? It's gonna be wheeze. There's gonna be wheeze in the patient due to bronchoconstriction. The second important presentation is going to be cyanosis. There's gonna be cyanosis in the patient. There's gonna be edema and urticaria is gonna be there in the patient. All right. What are the other features? What are the other clinical features of the anaphylactic shock? The other features of anaphylactic shock include tachycardia and hypotension. If there is hypotension, that means the BP is going to be low, and in that case simultaneously there is going to be tachycardia, and there's going to be wheeze, laryngeal obstruction, cyanosis. I already told you. There's going to be itching, there is going to be sweating, and there's going to be diarrhea, vomiting, erythema, urticaria and edema. Okay, you have to remember all these clinical features, and that's how you know that the patient is having anaphylactic shock. Now coming to the treatment of the patient, what is going to be treatment in an emergency situation? For example, if a patient comes in casualty, and this is going to be the treatment. Firstly, you have to do is that ABC approach. What do you mean by ABC approach? Airway, breathing and circulation. You have to maintain airway, breathing and circulation. Secure airway by giving 100% of oxygen you have to give. Intubation if respiratory depression is imminent. If there is a respiratory depression, then you have to go for intubation. After that, remove the cause. If you can see the cause of the anaphylactic shock, remove that. Raise patient's feet. You have to raise actually the patient's feet. You have to little bit raise them. Okay. Then after that, you have to give what? Adrenaline. Give adrenaline intramuscular 0.5 mg. Adrenaline intramuscular 0.5 mg. You have to repeat this dose every 5 minutes if needed. It causes bronchodilation. In anaphylactic shock, there is bronchoconstriction, but adrenaline causes what? It causes bronchodilation. Then after that, you have to secure the IV access in the patient, and after that, after securing the IV access, you have to actually give what? Give chlorpheniramine 10 mg IV, hydrocortisone 200 mg IV, and after that start giving IV fluids. That is, the IV fluid of choice is 0.9% saline. If wheeze, treat the asthma. If there is wheeze, you have to auscultate the chest. If you find that there is wheeze in the patient, treat the asthma. If after that, if you still see that the BP is not rising and the patient is still hypotensive, you have to admit the patient in the ICU and start IV infusion of adrenaline. You have to start IV infusion of adrenaline. But before, you have to give what? Firstly, what you did, you gave intramuscular adrenaline, but now you have to start IV infusion of adrenaline plus or minus aminophylline nebulized salbutamol. All right. What is the most important point in this? If patient is on beta blocker, if you saw that, if you ask the history, if there's somebody accompanying the patient, and if the patient is on beta blocker, consider IV salbutamol in place of adrenaline. Then you don't have to give adrenaline, you have to give IV salbutamol, not IV adrenaline. All right. That is the simplest way you can actually remember the anaphylactic shock. If you remember this, that is gonna be the game changer. Thank you for your attention. Have a nice day ahead. I'll see you in the next topic. Till then, please take care.